It was like a really big, like, whoa, what am I gonna do now?
Now, in her senior year, the coronavirus has changed
information to us every day. 139,497 people have been tested and had results reported in LA County. 14% of the people who are tested are positive. And again, that number has not changed much over the last month. I want to encourage everyone to get tested, particularly if you have symptoms, and to note that the test only takes a few minutes. There are appointments available at the regional testing sites. You can go online and find the testing sites and make an appointment at covid19.lacounty.gov/testing. As we move through this pandemic, I want to share some context on the numbers that I report every day. There are many unique challenges here in our county that make groups of people particularly vulnerable when there's community spread of a new or novel virus. In certain parts of the county, especially certain neighborhoods in LA City, there's high population density, and this means that there are many people that are living close together. When people live in close proximity to one another, it's much easier for this virus to be able to spread. We also have among one of the largest populations in the country of people who are experiencing homelessness, and also people who are marginally housed. And we have a large number of people who live in poverty. These are community members of ours who are at greater risk for poor health, and if infected with COVID-19, they may experience more serious illness. So I ask that you help us make sure that people who have increased risk have services and support that they need so that they can both get tested, treated, and receive support services to avoid them falling victim to COVID-19. The fact is, we also have a large population of medically fragile people living in skilled nursing facilities. We have 379 skilled nursing facilities across LA County. And this means that there are as many as 35,000 to 40,000 elderly, medically fragile residents who live in our nursing facilities. And they're also at much more increased risk of both contacting the infection and also having serious illness should they get infected with COVID-19. These factors do contribute to relatively high numbers of hospitalizations and high numbers of deaths that we see in LA County. And this is very similar to other large and densely population cities and counties across the country. In spite of our vulnerabilities, we're also seeing our rate of hospitalizations and our rates of people testing positive for COVID-19 remain fairly stable over time, with hospitalization rates remaining at about 22 to 25% of all cases, and positive test results remaining at around 12 to 15% of all tests. This is because of all the work you're doing to slow the spread. And as we prepare for recovery, tracking the information on the number of new hospitalizations every day will be critically important to assessing how well we're continuing our work to slow the spread. And in closing, I want to thank you again for doing your part to protect our community and to save people's lives. The key to getting through this, including through our recovery, is working together. And LA County is blessed to have both strong leadership from our board and our mayors across all of our cities and our residents and community organizations. And I know we'll continue to do an amazing job at collaborating as we prepare for our recovery period. So please, for now, I ask you to keep doing what you're doing. Follow the safer at home orders and take measures to prevent the spread of the virus and protect your loved ones. Infection control practices and physical distancing will remain with us for months to come. So it's good to get these down and to make sure that these tools we all feel comfortable using all of the time. They do slow the spread. I have enormous gratitude for all of you and for your service and for working together to, in fact, slow the spread of COVID-19. And I'm very proud to be part of the LA County community. And now I'd like to introduce Dr. Galley, the Director of Health Services.
Good afternoon, and thanks for joining today. My thanks to the board and to the Department of Public Health, to Dr. Ferrer and all of her team for their leadership in helping us move to recovery. Yesterday, the governor of California released his 4-stage plan for reopening California. The state will be relying on 6 different indicators that will determine when we are ready to progress to the next stage. One of these indicators is specific to the stability of our health and hospital systems. We need to have stable hospitalization trends and adequate surge capacity within the hospitals to care for both COVID patients as well as those with other conditions. In assessing our readiness to proceed to the next stage, we will continue to share information on hospital system capacity and projected demand trends. My continued thanks to Dr. Roger Lewis and to his entire team for their continued work in tracking this data across Los Angeles County and using it to project anticipated bed demand over the coming month. Our latest modeling continues to show that physical distancing is preventing transmission of COVID. The model predicts that if we reduce physical distancing, hospitals would experience an increase in patient volume after a delay of approximately 2 to 4 weeks without the implementation of other effective control measures. I'll go through in just a minute our modeling updates rather quickly, but I want to be clear. Safer at home and physical distancing is working and has been effective in flattening the curve in Los Angeles County. But I know it is also very difficult. We all feel it, and many are suffering economically as a result of the measures that the virus has forced us to put into place. But with the stability of the health system, Los Angeles County is one step closer to being able to begin paring back gradually the safer at home restrictions over the coming weeks. As restrictions are eased in a few weeks, we must continue to ensure that we are physically distancing as much as possible at the same time that we're working to get people back to work and restarting the economy. Physical distancing will be our new normal for quite some time. Turning now to the slides. Our first slide shows the hospital patient projections. Our new case projections continue to be well within the expectations and the band of uncertainty that we've outlined previously. There was just a slight increase week over week of new cases that required hospitalization. This means that our hospital system continues to be able to support those who need care, both for those with COVID-19 and those without it. I want to take this opportunity to remind people that the hospital system is there for you, and it is able to take care of you whatever your physical condition is. If you're having a medical emergency, if you have chest pain, if you're having symptoms of a stroke or other concerning symptoms, please go to the nearest emergency department or dial 911 for assistance. We do not want people to stay at home with what may be life-threatening conditions. The hospitals are there for you and can take care of you throughout this COVID-19 pandemic. On the next slide, in terms of beds, we're seeing that patients are spending longer in the hospital than what we previously modeled and anticipated. This means that compared to what the model showed us last week, the bed projections are slightly higher. We're still learning about the clinical treatment and the course progression of those with COVID-19 and are learning directly from the experience of real patients in Los Angeles County who have the disease and are receiving care across public and private hospitals. We're using this local data from the hospitals across the county to be able to inform the model's projections. Despite this increase in the length of stay, we are still well within the hospital system's capacity to meet our anticipated demand for beds. On the next slide, we'll shift to a look at the ICU bed capacity or intensive care unit capacity. Week over week, we are seeing largely similar projections around ICU bed demand and capacity. We continue to prepare new ICU beds so that we can activate those and bring them online if the need arises. The next slide focuses on ventilators. Same thing, week over week, we still project that there is a sufficient supply of ventilators for those individuals who require mechanical ventilation to support their breathing. On the next slide, the model continues to show that we must maintain physical distancing and that if we were to pare that back suddenly to pre-order levels, the situation would be dire, with the vast majority or virtually all of the county and the residents of the county infected by summer. In closing, I want to offer my sincere thanks for the healthcare workers on the front lines and for all of their amazing work and dedication to caring for those in need. And my thanks to every one of you as a member of the public for obeying the Safer at Home health officer order and for physical distancing as much as possible when you are outside of your home. Your actions have saved and are continuing to save lives. With that, I'll turn it over to Ryan for questions.
On today's call, please press 1, then 0. Our first question will come from the line of Betty Halsell with the LA Sentinel. Please go ahead.
Hi there. Thank you so much for taking my call and delivering this news every day. The whole team, Barbara Ferrer, Catherine Barger. I just need clarity, and this first question is directed to Catherine Barger. I just need to know, where exactly are we seeing, is there a public chart in place that's visible that has the measurable numbers in order to reach the 4 benchmarks that you outlined previously? For example, or for instance, do we need 50 more test sites to see, results? Do we need, how many isolation locations do we need in order to, relax the Safer at Home order? I also take into the fact that we are aligned with the California state governor, but I kind of just want to see a visual if that's available. And then the second question is for whoever can answer. I personally see the reason why the numbers reflect a disproportion rate within race and ethnicity is because there's an inequality within race and ethnicity within the city as far as resources go. I see the elderly being prioritized daily, which is needed, granted. I see first responders being prioritized daily, also very much needed and grateful for that. But I'm only hearing the numbers regarding the need to close the gap in resources for the underserved communities, in specific African Americans, since we, have acknowledged week after week that we are the highest death rate within COVID-19 related deaths. So I just want to know exactly what we have in the future, because we are entering a new post-pandemic era. What exactly do we have in plan? What motions are on the table to close that gap? Thank you.
So I'll answer the first one. I can be pretty short because your second one I'm going to let Dr. Ferrer talk about, and if Dr. Galley wants to. But on the first one, those 4 measurables were created through the Department of Public Health, and I will make sure that we put up online something that shows what the measurables are, because quite frankly, we're depending upon public health based on the numbers each and every day, and then we look at it across the week and actually the month. So I promise you we'll get that up there for you, so that there's something that will tell people what the measurables are, especially around the testing component of it. But I'm going to let Dr. Ferrer talk about the second question regarding minority communities and lack of access.
Yeah, thanks so much, and I appreciate the question I appreciate both questions, making sure that we're transparent and people know what are the metrics we're using to both gauge what phase we could be in terms of our recovery, but also then to make sure that we're not seeing some numbers that would cause concern and ask us to go back and reassess what we need to do in terms of our health officer orders. But I think the second question is extraordinarily important, and we did post a plan yesterday online, so I urge you and our viewers and listeners to feel free to look at the plan. We also are asking people to help us implement the plan. It's got about 8 different suggested areas of action. The most immediate focus for us, however, is to make sure that there's good access to testing. And I want to thank Dr. Galley, and she can come and talk a little bit about how she's making sure that that access is appropriately being distributed to make sure that those communities that have had the least amount of access see more access, but also acknowledging that we need to make sure that these testing opportunities are embedded with our trusted providers in many of our communities. So I think the testing strategy Dr. Galley could talk more of, but that's number one. You know, if you can't get easy access to testing, it's pretty hard to know whether you need to isolate and your close friends or family members need to be quarantined. So we've got to improve the ability for people to get tested. And along with that is, for people who are testing positive, it's extraordinarily important that they're connected to care. At this point, given the higher rates of chronic diseases in many of our communities of color, making sure that people understand that, as Dr. Galley mentioned, our hospitals are safe, our clinics are safe, and people who have underlying health conditions at the first sign of illness during a pandemic really need to feel like they've got a place to go. And if they don't feel like they have a place to go, we need to help make sure that we're available to help people find an appropriate provider. And along with access to treatment for health issues, it's really important that people have support that they need. These are extraordinarily difficult times. They're more challenging in communities that have not had access to the appropriate level of resources and opportunities, again, disproportionately among our communities where people have less income and where, in fact, there are people of color that are living in greater numbers. And this is the support part of the house. And the county family is here, again, as a family, to make sure that people are, in fact, finding access to meals and to food. And for those people who are homebound, there's a lot of expansion of our ability to deliver meals to people's houses. But we have to connect the services that are here with the people who need them most. And those are the immediate action steps for us. Making sure people can get tested, making sure that people are connected to healthcare services, they have good access to really skilled medical care and needed care, and that we're providing supports so that during this difficult time, people have what they need to really feel both cared for and to be able to survive. So, but we have 6 other items that need action that are listed in our action plan, and we're happy to get suggestions. We're relying very heavily on our community partners to help develop both this plan, but also the plans to really address the underlying inequities, the root causes of poor health among many people of color. So thanks for that question. We'll go on to the next question, unless Dr. Galley wants to talk about testing.
Just briefly on testing, we're focused on a several-fold plan to be able to ramp up dramatically the number of tests that we're able to perform across the county. This is focused on several different populations. First, obviously, anyone who's symptomatic needs quick and easy access to a test. And then, as Dr. Ferrer pointed out, they need to be able to be linked to the healthcare system to provide for their ongoing clinical needs. Then there's focused testing that is needed for those in institutional settings. That includes the skilled nursing facilities as well as other long-term care or congregate living facilities. It includes those who are in correctional environments, in the jails, the prisons, and the juvenile halls and camps. We also need to make sure that there's implementation of testing strategies for those in congregate living situations for people experiencing homelessness. This includes the shelters as well as other encampments for people experiencing homelessness. There's also strategies that are needed to be able to focus, I think, in part to get at your question, on specific at-risk groups, even beyond those vulnerable populations who are in the institutional settings. We're all deeply concerned by the data that shows that individuals Asian Pacific Islanders, African Americans have higher mortality rates from COVID-19, and we need to make sure that the test strategy is responsive to that. The preliminary data from the testing sites, the drive-through testing sites that have been rolled out across the county, is that that the test access very closely mirrors the ethnic and racial mix of the county, but we need to do more and better than that so that we're enriching testing in communities of color and in low-income communities who appear to be particularly susceptible to mortality from COVID-19. And so efforts to expand testing access points, which will be continue to be rolled out over the coming week, will focus on testing deserts, focus on low-income communities, focus on communities of color so that we can make sure there's easy access, and then critically the connection to healthcare services across the entire county. I'll take the next question.
That comes from the line of Jim Roop with Westward Run News. Please go ahead.
Thank you very much. Good afternoon, everyone. Again, curious about recovery. As I understand it, to be considered recovered from COVID-19, you have to have 2 negative PCR tests within a 24 or 48-hour period, something like that. Total number of cases in LA County since we started counting, 22,485. Number of deaths, 1,056, which leaves 21,400 left. How many of those people are recovered? Certainly we are keeping track of that. I don't imagine that 21,000 people are still infected with the virus. So how come we're not hearing about the number of recovered? Because that would be very, very important in the numbers that you do give us.
Thanks so much, Jim, for that question. So at the very beginning of the outbreaks across the country, the federal government through CDC recommended that cure test that you're talking about, that people needed to be tested after they were positive for COVID-19. They needed 2 tests, 24 hours apart, and both tests needed to be negative. CDC dropped that requirement early on because there was a real lag of appropriate testing for people who were ill, and there was a lot of testing that was going to determine whether someone was cured, and instead went to more prescriptive formula that says after well, at the time it was after 7 days.
All right, everybody, Los Angeles Mayor Eric Garcetti just took to the podium. Let's listen in live here on News Now and on now.com. Not quite sure if they have the audio up yet, everybody, because it appears it hasn't officially began. So hopefully the audio will come up here in just a second.
You're all good. Just in the nick of time.
5, 4.
Good evening, Los Angeles. During nearly every day in this crisis, there's been some milestone, some holiday, some celebration, anniversary, or usual marker missed while we're at home. Moments when we typically come together and unite around a mission or a cause or a moment. And today is no different, because today is Denim Day. You might see a suit up here, but I'm wearing my jeans down here. A day which for over 20 years, I, with so many other people here in Los Angeles, around this country and world, wear denim to mark our work and raise awareness about sexual violence and sexual assault, and to make sure we do everything we can to stop it in our midst. At a time when so many of us are vulnerable because of our stay-at-home orders, our health and safety are paramount in all of our minds. And so no one is more vulnerable than a survivor of assault, one who every single day lives with transitioning from a victim to a survivor and moving on with her or his life as best possible. Today, we have to, even if we can't stand shoulder by shoulder, we have to metaphorically stand shoulder by shoulder with all victims of sexual violence and assault. One in which I remember the first day I wore these jeans, and we got a call when I was a council member to my office, and they said, "Why is my council member wearing jeans?" And a conversation ensued about a case in Italy where a judge overturned a rape conviction because the woman was wearing tight jeans, so she must have given consent. That started a worldwide movement, and Patty Giggins and Peace Over Violence, an organization based right here, has taken this worldwide. And so we say today that here in Los Angeles and nowhere in this world will we tolerate sexual assault or violence. And for those who are experiencing violence, even in the midst of this pandemic, please reach out, get help, call 911, allow our police officers to get you out of a dangerous situation and to bring perpetrators to justice. And to the survivors in our communities, remember, you are not alone. We are here with you. We are here to hold you. We are here to make sure you get through this. And we are here to ensure that this doesn't happen to somebody else. And by speaking out and speaking up, we can get you the help that you need and ensure that we see one day in which we eliminate sexual violence in our community. This is the same ongoing commitment of solidarity, of love, of support that we bring to our fight against COVID-19. Winning that battle starts with understanding what numbers tell us about where we stand. So let me begin, as I always do each evening, with the data from today. As I always mention too, our data snapshot, our summary, is available online at coronavirus.lacity.org. The same deck of information I get each day is available for you, so check it out. We can't go through every number in this briefing, but there's valuable information for you, your family, your community, and for one day, us making forward motion to getting back to normal. Today, the county reported 1,541 new cases, bringing the total number of confirmed positive COVID-19 cases to 22,485, a 7% increase since yesterday. For comparison, the past 7 days, we've seen an average daily increase of 886 new cases a day. As I've said, these are the reported cases in the last 24 hours. Doesn't mean these are the cases that have become positive in the last 24 hours. We smooth these numbers out, some days higher, some days lower, to an average that helps us know exactly where we are today. In the city of Los Angeles, there were 683 new cases. That brings the total to 10,380, a 7% increase as well. And we learned of 56 new deaths countywide, bringing our total to 1,056. This is a 6% increase since yesterday. And for comparison, we've seen about 47 deaths per day for the last 7 days. Across the county, our general emergency hospitals have right now 1,276 beds available, including 1,018 acute care beds, and ICU beds are at 258 available, as well as 1,091 available ventilators. This continues to hold good numbers, making sure that we haven't exceeded our capacity even as our cases continue to grow. The Los Angeles County Public Health Department also released a very important report that I hope you will check out But let me summarize a couple things that talked about breaking down the number of COVID-19 cases here in Los Angeles and deaths by neighborhoods. These numbers showed us that on the whole, working class Angelenos and those living in poverty are suffering disproportionate rates of infection and some of the highest rates of death per capita in our county. In analysis of the data, the LA Times noted that some of our lower income neighborhoods in central Los Angeles are losing more than 40 people for every 100,000 residents, a rate 4 times higher than the county as a whole. Many long-term care facilities are located in lower income areas, and we think that's a part of this. And in this new data, in part, it reflects the tragic reality that this virus is hitting our elderly population especially hard, as well as those who are comorbid, a technical term meaning people who have pre-existing and vulnerable conditions. But it also tells a story that I've tried to paint in these briefings, that this pandemic has created new injustices and highlighted old ones, that while the virus can infect everybody, it doesn't affect everybody equally. It lays bare long-standing inequities in our city and our country, trends that are the result of generations of neglect, discrimination, and bias. That's why equity and access have guided our work since the very beginning, and why we've worked to quickly expand testing in those neighborhoods that are hardest hit. Because along with hand washing and disinfecting, covering our faces and physical distancing, testing is one of the best tools that we have to stop the spread of this virus. That's a truth we realized from the very start of our fight against COVID-19, and we acted swiftly to ramp up testing everywhere in Los Angeles. Early on in this crisis, LA stepped in to fill a national void, and we launched our own testing program. We started 40 days ago, quickly building a testing infrastructure from the ground up. And I'd like to take a moment to lay out the scale of that so that you can appreciate the hard work of all the volunteers and firefighters, city officials, county officials who have worked to make sure that there are tests available to those who need them. It was Friday, March 20th, starting in a parking lot in Elysian Park, that the city began testing our first responders. And on that first day, we had the capacity to test 145 people. It seemed like a big number at the time. It was a small number in retrospect, but it was an important milestone. It kicked off a massive scaling effort. Not one day went by when that effort didn't continue to expand our capacity. That first week, by March 27th, we tested 5,000 people at 4 locations across the city. And on March 30th, Community Organized Relief Effort, or CORE, teamed up with the city to help us scale at our testing sites in Northeast Los Angeles, South Los Angeles. And on April 1st, we were joined by the county to expand testing for people across the entire county of Los Angeles. On April 3rd, we were up to 12 testing locations across the county, including 6 within the city, with a capacity to test 3,500 people in a single day. And a week after that, on April 10th, we nearly doubled our testing locations and capacity, surging to 22 locations and 6,000 people per day. And we said we'd double our capacity again, and by April 17th, we were up to 12,000 people per day. Today, we're at 34 testing sites with a capacity to test 18,000 Angelenos every single day. And over the past month, we've tested over 140,000 people just through those centers. Let me put that in perspective. In the United States, the COVID Tracking Project estimates there are approximately 200,000 tests a day. In Los Angeles County, where we just have 3% of the population of the nation, we have the capacity to conduct roughly 9% of all tests in America. This hasn't been a race to blindly ramp up testing. Like scientists working around the clock right now to find a vaccine and therapeutic drugs that can help with this crisis, we have made targeted testing decisions to help us ramp up in the right way, with the right populations. Early data showed that COVID-19 was disproportionately impacting African Americans, so we quadrupled the size of the Crenshaw site. We opened up a walk-up center in Kedron Community Health Center, and through our partnership with the county, new sites were added in Inglewood, Charles Drew University in Willowbrook, and we saw outbreaks at skilled nursing facilities, so we surged teams and tests to those folks where our grandparents and parents might be, and where our vulnerable seniors live. And we became the first big city, and maybe even the first city in America, to mandate monthly testing be available at all of those skilled nursing facilities. We know that unhoused Angelenos, many of whom have underlying conditions, are both susceptible and vulnerable. Susceptible because they're on the streets, vulnerable because of their pre-existing conditions. So we stood up a testing facility on Skid Row, which in 9 days has tested more than 600 people. Just 3 of those so far have been positive. We have increased our testing capacity, but we have to keep doing more. I've been driving my team since the beginning, and I want to thank all of them, led by Jeff Gorell, our deputy mayor, led by Dr. Eckstein, his counterpart, Dr. Kazan, and all the folks at Public Health and Health Services in the county, as well as cities who have helped stand this up together with CORE and other volunteers. As long as this disease spreads, we have to continue to scale. And as long as this disease takes lives, we must test. We know that coronavirus is a silent killer that moves quietly through the population. And many of the people who transmit the disease, this is why it is so deadly, don't know that they have it. We call it asymptomatic, but let's just say they don't have symptoms. They're infectious, but they're not showing any symptoms. And this illustrates why making testing available to anyone who wants it is essential. We heard national leaders talk about that in early March, but it's been difficult for folks to scale that up, which is why tonight I am so proud to announce that Los Angeles will become the first major city in America to offer wide-scale testing to all of its residents, with or without symptoms. And we did that in just 40 days. So all of the things I've been talking about, worrying whether you work in a critical sector, whether you have symptoms or not, moving forward, in the city of Los Angeles, you will be able to, whether you have symptoms or not, get tested. Those with symptoms will of course have the first priority, but we have the capacity, we believe, to move forward with that starting tonight. So if you think you might have COVID-19, want the reassurance that you don't, if you've been around people that you have seen with symptoms, get a test. We can do it. And I want to remind everybody, these tests are free for the public. No cost at all to you. But you can't put a price on the peace of mind of knowing that you can't infect somebody around you. So sign up tonight at coronavirus.lacity.org/testing. We have the capacity, so don't wait, don't wonder, and don't risk infecting others. This is a really important step to prepare for other steps forward in the weeks to come. We want everybody to be safer at home, but for some folks, we know that home is not necessarily a safe place due to domestic violence. And Los Angeles' domestic violence shelters typically house survivors and help them get to other housing within 30 to 45 days across a network of 1,000 beds. But as a result of this pandemic, obviously, people had to stay in place. There's no place for them to go, and those beds were full. A lack of available beds for new individuals seeking help and seeking hope suddenly dried up. And that's a problem that our LAPD has seen, a spike in daily domestic violence calls. And we have to meet this incredible need and ensure that survivors of domestic violence are met with critical care and support and do not become homeless as a result of this violence. And that's what we're doing. I mentioned it before, but let me spell it out. Rihanna, through her Claire Lionel Foundation, and Jack Dorsey, CEO of Twitter, through his Start Small initiative, they stepped forward and they donated $4.2 million to the Mayor's Fund to launch Project Safe Haven, which will house up to 900 families over the course of the next 3 months. I thank them both for their hearts, for the speed with which they did this, and the ability to save lives as we're saving lives. And I want to recognize a dear friend and the president of our Library Commission, Mai Lassiter, who played an instrumental role in getting this done. Thank you, Mai. Contracts have been executed between the Mayor's Fund and nonprofit organizations to provide case management, wraparound services for the 900 domestic violence survivors identified. And I'm very grateful as well to Lyft, which has stepped up and generously donated vouchers to transport these individuals and their families to these safe havens. So if you're a survivor of domestic violence or you're a victim tonight, we've got a resource to help you. Reach out. As I mentioned, you can text 911 if you feel that you're in a dangerous situation. Call 911 if that is available to you. Or go to coronavirus.lacity.org/DV resources to learn how you can get the support that you need and that you deserve. One individual who was placed into safe housing the other day had been forced into prostitution by an abusive partner. She and her son, who suffers from autism, were in a horrible, dangerous situation. But she reached out, and Project Safe Haven was able to place her into safe accommodations. Out of danger, she said, and I quote, "I can't believe people care enough about me to give me this opportunity." I want her to know we do care about it. You and any other survivors that are out there right now. I want every domestic violence survivor to know we care about you. Your safety is not an opportunity, it is your right. And you're not alone, and Los Angeles is here to help in the midst of this crisis. Every step we've taken during this crisis comes from a central impulse to protect the people of Los Angeles. That's why we're extending protections to survivors of domestic violence. It's why today I signed into law both a right of recall ordinance and a worker retention ordinance, which will ensure that workers who are hardest hit in those hardest hit industries, who have lost their jobs as a result of COVID-19, will be the first in line to get their jobs back once rehiring begins. And I want to thank Council President Noreen Martinez and her colleagues for leading the charge to get this passed through the City Council, and for her relentless advocacy on behalf of workers across Los Angeles. There's no doubt that we will feel the impact of this pandemic for some time, and the road to recovery will be long, but it's never too early to begin planning to put people back to work. From our hotels and our airports, from our restaurants and entertainment venues, LA's workers bring our city to life. It doesn't just happen magically. It happens because of hard work, and we want to reward that hard work moving forward. So let me make this commitment to you, the workforce that's been furloughed and is working without pay. In your moment of need, we will honor your experience. We will not let you be undercut by newer and lower wage workers. We will protect your jobs and your livelihoods. We owe you nothing less. As this crisis continues, my friends, I know it's tough not to start to grow restless. Everybody wants to know how this moment ends. They want to know when this moment ends, how we can emerge from this darkness, and what our brighter future, our new normal, might look like. You welcome me into your homes every single night through this address to offer answers and ideas and solutions. And I promise you that every detail that I have, I share with you as soon as possible. So I promise in these coming days, as we get close to May 15th, which, as I say each night, is not some magical flip of the switch or an opening of the doors and going back to what it was like before, but will be the beginning of our first steps out, if these numbers hold, that we will plan those things openly and together with our county, hopefully within our region, across cities, and of course, communities as well. That whatever it takes to flatten this curve, to keep strengthening our response, and to eventually start reopening our economy, to begin the long, hard work of both recovery and reimagining. Some of the days this week we'll be talking a little bit more in depth about how we do that. And look, I'll be straightforward, just as an Angelino, I know it can get confusing. You hear some things at the national level, and the state level, and the county level, and from a mayor. I try to synthesize all of those because I find them all helpful. What Governor Newsom has brought and his leadership, which has been tremendous. What we hear from national leaders who can give us guidance, and working closely together with my fellow 88 mayors across this county and our neighboring mayors up and down this state. We have you in mind. We want to make sure your safety comes first, that we don't make a misstep that results in crowded hospital corridors, more people dying, but that we also don't throttle the future and see opportunity disappear, something we can never recover from or rebuild from. So I want to thank you for your patience. I want to thank you for your persistence, and let you know that towards the end, when we look at these days, the 2 weeks that are leading up still to the May 15th deadline, it's like the end of a race when you feel tired. I know the temptations are to get out there. Temptations are to maybe sneak away and do something that you know you shouldn't. We have to finish this race strong. And there's another race waiting the next day. As I mentioned, this won't stop anytime soon. It's going to be a series of sprints for a year or more. But I'm confident in you. I'm confident in your generosity. I'm confident in your strength and resilience. I'm confident in your discipline, because the numbers don't lie. LA has saved lives, and we're going to need those same qualities to continue saving lives and rebuilding livelihoods. So let's keep it up and stay safe and stay healthy and stay at home. Thank you, Los Angeles. As always, much love and strength to each one of you. With that, happy to answer questions. First question, please.
First question from Laura Nielsen with LA Map.
Hi, Laura.
Hi there. Thanks for taking my question.
Of course.
So, as you know, dozens of cities around the world, including many in the U.S., including New York, Denver, Oakland, San Francisco, London, have started restricting car traffic on some streets to give people more space to walk and bike and take social distancing while they're outside. Why hasn't LA done that?
We are going to. I'm very supportive of that. We have a working group across the city. I think it's really critical how we do it and when we do it. That we not, as we saw at the beaches, there's some places, Australia's opened their beaches from 6 to 9 in the morning to exercise. It's been a successful way to open beaches. We saw pictures in Orange County that looked maybe potentially less successful this weekend. So it's very important not just that we take action, but we do it the right way. So we have a working group right now that includes my office, council members' offices, our Department of Transportation, our Bureau of Street Services known as Streets LA, and I do hope that we can do that in many parts of the city. I think it's important not to jump the gun before the May 15th deadline to make sure that we listen to county public health. I've talked with Dr. Ferrer. She doesn't support that at the neighborhood level at this point. It could draw too many people to one area. It could be something that spreads the disease. So we have to be extremely thoughtful, extremely careful about it. But it is something I absolutely do support. And as we know that there won't be a full-scale reopening, I think it's an exciting moment for us, especially people who live in dense parts of the city who really don't have any place to go. That if we can find streets that we can safely close in a network of an area so people don't go to one area, but everybody has places close, that is the criteria that I asked my team to look at and that we will as a city. So I'm excited to do that. I support it. It's something that will be forthcoming, but that planning is already underway. Thanks, Laura. Next question. Hey Jim, how you doing?
Very well, Mayor. Good evening.
Good evening.
Thank you very much for taking our questions, and please thank your family too.
Thank you.
Must be a very understanding family.
Yes, I appreciate it. They are.
Be out so much to do this. We appreciate that. One of the things that is coming up is, at least a lot of questions coming up, is that as people start getting real optimistic in some recovery, to see a light at the end of the tunnel, so to speak, with some of the measures that the governor has talked about, and some of the things you've talked about. So as we look toward recovery, there's some concern that eventually this is going to be put on the backs of the taxpayers. So how do you reassure Angelenos that when push comes to shove and the economic reality starts to hit how much loss there was in the city's economy, that taxes aren't going to be raised or that things aren't going to happen, and it's going to wind up putting a lot of burden on the residents of this city?
Well, there's no question coming out of this that not just a reopening, which I remind people will not just be a linear reopening, meaning that we take steady steps. There's going to be times we take steps forward and the disease will cause us to retreat. There's times we're going to take steps forward and we didn't figure out how to do it right. The safety protocols didn't work, the physical distancing didn't, and we'll have to retreat. Other times we'll take steps forward and the world won't change, or it'll still be getting better, and we can take bigger and bolder steps. But you're right, it's not just about reopening, it's about this recovery, and who will pay for it. It's my philosophy, two things. One is the best thing we can do to pay for recovery is to get our economy going. That when people pay normal taxes because they're back at work, because we have businesses paying sales tax, that is the best way for us to finance recovery. Second, though, there's no question this will be shared sacrifice by all of us. Many have sacrificed who are at home. We made sure as a state and as a country we're paying for unemployment for people who can't work. Those of us who are working are getting haircuts. Many are furloughed, taking pay cuts. Other people are looking at what we need to do to make sure we get help from the federal government. And every night I've said, we can't do this if the federal government only bails out big corporations and banks, but doesn't help cities and states. Because we provide the critical city services, not just now during this crisis, but the ongoing crisis, and that keeps people safe. Domestic violence survivors need to have somebody to call at 911 and make sure that a cop shows up. We need to make sure that when somebody's having a heart attack, that there's a firefighter there. We We need our trash picked up. We need to make sure our parks are safe and green and beautiful. So there's no question there will be shared sacrifice, but I'm trying to do my best to limit that impact, especially on lower income and working class Angelenos, middle class Angelenos, who are the hardest hit by this. We don't anticipate right now balancing the budget by raising taxes or raising any fees. I can't speak at the national level where obviously they're spending a lot of money, how in the long term they will pay for that, but at least here locally, we squirreled away more in the reserve fund than ever in our history, double what it was before the Great Recession. But this is also going to hurt more than the Great Recession. So to me, the best thing we can do is to enact smart ways that are safe to us to open the economy and ways that get more people working, get more revenues paid, get more people who are, going to places that give us sales tax and parking tax and other things, and that should lead the way. If you go with taxes first and no businesses can get back up and running and they can't hire any people, it's like a never-ending sinkhole. So we'll be looking at that, more on that later this week when we're announcing some of the folks who are going to help us do that planning and that reimagining of the future in a couple days. Thanks, Jim.